Hi, we're Group H and our project is called Conversational Patient History, and it's a project aiming to automate the process where clinicians speak to members of the family or the school of a patient possibly being considered for a diagnosis of ADHD or autism. The project aims to create a dynamic questionnaire which takes in the answers from the user and uses an LLM to decide the next best question to ask. The project then takes in these answers and generates a report to be used for diagnosis. It also analyses the answers and aims to flag any areas that need to be asked about further by the clinician. The reason for this project is to save clinician time and free them up to do other tasks, because this collection of developmental history and report generation usually takes around 4 to 5 hours, which is now saved due to the automation of this task.
Right, so great intro from Jenna there, and I'm going to give a quick demo of the actual product in action. So they've got a quick logging screen. Right, and then you can see all of the, if this software is being used by a teacher or a parent, then they can see all of the different forms they've got going on at the same time. So we'll have a look at J and Doe here, which is, you can see it's 88% done overall. Is that a low notification?
Sure.
And this will open up to the place they left off last, and you can see a quick summary of the category they're in, what questions we'll be answering. So these are the questions that a clinician would usually be asking a patient, but instead it's asked by our software. They give the answer. We give an answer. In this case, it would be no, and then this sends a request to the LLM, and that will decide whether the question needs extra investigation or whether it's okay to just skip over. We can see the LLM has responded. Okay, so I'll give a quick demo on the actual product in action. This is after you've logged in. You get asked whatever question that the client would be asked by the clinician, then you type in an answer, such as, not that I have noticed, and then save and continue. This gets sent to the LLM for processing, and then this is the last question as well, so it should move on after that, and then a report can be generated. Perfect. Then you can go back to the main screen. Then you can see that we've got 100% on this client we've just done, and then I'll pass it over to Ben, who will show you the report generation.
Finally, we have the admin interface, where if you have an admin password and you log in, it will show you your assigned patients and you can download their reports. The reports take a while to download as the LLM has to process, and it's a small LLM. So to save time, I have got a pre-generated report here, and as you can see, it's very nicely written. One of the key benefits of this project is that the user does not need to fill out the form in one go. They can leave at any point and resume later with their progress saved. If a user does not make any progress on the form for 48 hours, we will send them a notification. We have used a free service called Firebase Cloud Messaging.
One of the technical challenges was deciding how to implement the LLM and the privacy issues surrounding it due to having to send requests with sensitive client data. Therefore, we used a locally hosted model. It also has significant hardware requirements to run large models, so a smaller LLM was hosted locally to show that it's possible, and a larger LLM was used using an API to prove that quality responses can be produced. In an ideal world, we would have created our own LLM trained on patient data. However, we were not allowed access to this data for privacy reasons. One challenge for the report generation was the client requirement for flagging questions when they needed further exploration by the clinician. There were two main reasons questions would be flagged, either because the answer was unclear or if there was an issue raised that the clinician needed to look into separately. In order to prevent the LLM speculating about what is an issue and what isn't, we spoke to the client and just decided to flag based on the clarity of the answer. The report then lists the questions that need to be asked about further in the report. However, this is a subjective line, so may not be correctly classified as the clinician would do.